Hello, I'm Dr. Alexis Reid, naturopathic doctor. Today I wanted to start a series on fatigue, something that affects plenty of people in our society, especially women. So I'm going to start with one of the common causes of fatigue, and that is thyroid dysfunction. So first off, what is your thyroid? Your thyroid is a butterfly-shaped gland, and it's right, if you imagine where an Adam's apple is in a man, it's right behind your trachea, right here. If you wiggle your neck a little bit, you ideally should not be able to feel it. If you can feel it, it's generally enlarged, and your doctor will feel for it when you go to them for an appointment. So what is the thyroid gland? It's called the master metabolism gland of the body. Helps dictate a lot of processes in the body, from metabolism to temperature regulation, etc., etc. It's commonly dysfunctional more so common in women, and also in the postpartum period. So what are a few of the symptoms of thyroid dysfunction? Well, obviously one of them is fatigue. Other symptoms to look out for are cold hands and feet, dry skin, constipation, irregular periods, and brain fog or difficulty with concentration. So what is done to help with the thyroid gland? In mainstream medicine, they will supplement your thyroid with T4, which is levothyroxine, and that helps your body have enough T4, so it reduces the amount of TSH, or thyroid-stimulating hormone. That's the signal that comes from the brain to the thyroid. And that makes some people feel better. Some people, however, do not feel better even when they're medicated, and that is most likely due to the fact that T4 is less active than T3. So T4 needs to be converted to T3. There's a lot of enzymes and cofactors and other nutrients that help in that process, and zinc, selenium, and iodine are some of them. So for people who are on their medication but still not feeling better, there may be something going on with their conversion rate of T4 to T3. Tips and tricks for people with thyroid disorders. There are certain foods that are labeled as goitrogens, or foods that are not helpful to the thyroid if you're having problems. Main ones of those are the brassica vegetables. So broccoli, cauliflower, kale, Brussels sprouts, these sorts of vegetables. People with thyroid problems should not eat them raw. You can still eat them cooked, because they don't interfere with the processes once they're cooked, but in the raw form you should try to avoid them. Gluten is also known to cause antibodies to the thyroid and can exacerbate thyroid problems in people who are sensitive. So a gluten elimination is a good thing to try if you're having problems with your thyroid as well. The thyroid and the adrenals, which are the batteries in the body, are also intimately connected. So oftentimes people's thyroid will take the hit and start not functioning properly after long periods of stress. So managing stress, doing self-care activities, deep breathing, all these sorts of things are also beneficial to the thyroid. There are also plenty of botanicals or herbal medicines that can help modulate both adrenal and thyroid. So I hope that sneak peek to one aspect of fatigue was helpful for you. And if you are experiencing any of the symptoms listed above and you're not getting a good explanation for them, another one I don't think I mentioned was weight gain or the inability to lose weight with reasonable exercise and eating. The thyroid is definitely a major factor in that, especially in women over the age of 35. So if you're experiencing these problems, you should see your doctor or your naturopathic doctor and get some blood work done so you can see where your TSH or your thyroid levels are at. I hope you found that helpful, and if you have any comments, you can put them below, and please subscribe to my channel if you want to hear more health information. Thank you.